My name is Kim van Breukelen, clinical specialist for LivaNova. In this short clip, I'll show you how Perceval ballooning is performed. After the Perceval has been deployed inside the patient, according to our IFU, you must balloon it. The balloon needs to stay at 4 atmosphere for 30 seconds. The size of the balloon must correspond to the size of the Perceval valve. For example, a Perceval L valve needs to be ballooned with an L balloon, and a Perceval M valve needs to be ballooned with an M size balloon. Then the balloon is inflated at 4 atmosphere. An L size balloon is bigger in diameter than an M size balloon. So on the table here I have an L balloon, an L valve and an insufflator. On the insufflator handle you have an unlock function and a lock function. In the unlock function I can now use the insufflator as a syringe and fill the insufflator with as much saline as possible. I don't have to worry about the air bubble in the insufflator because the insufflator and balloon are used in open surgery. I can now attach the insufflator to the balloon and before it's used I will test it. Fill the balloon with normal saline and I can see that the balloon is completely intact. And now I can deflate it. And I make sure that the balloon is as small as possible before it's been used on the patient. On the balloon you can find a blue marker band. The blue marker band needs to stay above the leaflets of the Perceval valve. I can now fill the balloon with saline for as much as I can. Lock the insufflator and turn it to 4 atmosphere. When the balloon is inflated, irrigate the aortic root with warm saline. Warm saline will help the nitinol stent frame to return to its original size. With the balloon inflated at 4 atmosphere for 30 seconds, the inflow ring of the Perceval valve is being targeted. And as you can see, the leaflets of the Perceval valve are in no way interfered with or stretched. Deflate the balloon completely before it's removed from the Perceval valve. First of all, unlock the insufflator. Withdraw all the saline out of the balloon. And now you can safely remove the balloon from the Perceval valve. Perceval ballooning is performed to provide optimal seating of the Perceval valve in the native aortic root. It reduces the risk of paravalvular leak. The balloon only acts at the inflow level of the Perceval valve and does not cause any stent deformation or changes in its final geometry.